Now, the Office of Health Standards Compliance and the Health Ombud have released the findings of its investigation into Helen Joseph Hospital. Veronica Makhoali is tracking that story for us, and she joins us live now for a sense, Veronica, of what was said. So there were two sets of release of findings, one from the Office of the Health Standards and Compliance and the Health Ombud. Both of them very balanced in that some of the allegations made in that Tom Holland video from last year were substantiated, but some of them were not quite.
Yeah, no, certainly, Michelle. In fact, majority of the allegations that were made by Mr. Thomas Holmes were not substantiated, but two were, and that, of course, included the fact that he spent about 3 days in an emergency department instead of the fact that he was supposed to be in a medical ward due to the insufficient availability of beds. The second claim that was substantiated was, of course, about the issue of the infrastructure and the deplorable state of the Helen Joseph Hospital. But that being said, it did not, of course, excuse the Health Ombudsman as well as the Office of Health Standards just to really hone in on the fact that Helen Joseph does remain really an issue in terms of the Gauteng health system and what the services that it's meant to provide for residents. And in fact, I am joined by the CEO, Dr. Siphiwe, just to speak to us a little bit more about some of the findings and the recommendations that were made. We know that some of the claims that Mr. Thomas Holmes made were not substantiated, but it did give the opportunity for both the regulatory bodies to look at Helen Joseph and look at really what I believe could be a management crisis at the hospital.
No, that is very true. I think inspections of this nature give us a glimpse also of what is happening in our healthcare sector. And one of the major issues that we have raised even in other previous inspections is that we have a serious problem of management and leadership and overall corporate governance in our hospitals. Now, we have recommendations that were made along those lines by the Health Ombud report, as well as what we have picked up. Now, our functions now, following the release of the report, is to then monitor the implementation of those recommendations. Importantly, what we highlighted in this report is that there is an absolute urgent need to stabilize the leadership structure in the hospital, and that will certainly be monitoring very closely with the Provincial Department of Health.
And apart, of course, from that management crisis, which we are actually seeing in many of our hospitals, was also really just the lack of staff, that 30% vacancy in terms of nursing staff that is needed at the hospital. This is something that is obviously a huge problem, I can imagine, for Helen Joseph. What is the plans essentially to mitigate against this, and also the exodus that we're seeing of health professionals from those facilities?
Indeed, there are challenges around, the high staff attrition in our health establishments. And here we are going to then request the Provincial Department of Health, working with the district and the management team. As much as we have this challenge, we still have to mitigate and try to actually get to the source. We do know that there's a number of reasons why staff is leaving, among others, the low staff morale, which was indicated in some of our reports, and we are going to then request the Provincial Department of Health to sit down around the table and look at what are the immediate staff needs. During our inspections, it was revealed that there is shortage of mortuary attendants, of cleaners, of the nursing personnel, and those would be the staff that we would require them to actually prioritize.
And just before I let you go, it has to be said that one of the things that were mentioned was that you will continuously monitor the recommendations given to the management of Helen Joseph Hospital. I would like to bring in another situation where we saw ourselves gathering like this following the passing of Shonisane Lethole. This was during the COVID-19 times. He was getting treated at Tembisa Hospital. We heard sort of very similar, recommendations coming from both regulatory bodies. What is the update in regards to those recommendations? Have they been implemented at Tembisa Hospital?
So our main function does not end with only identifying what the challenges are and receiving the reports from the Health Ombud. One critical function, which then forms the overall end stage of what we do, is ascertaining that those recommendations are implemented. Certainly, we have been following up with the Tembisa Hospital management team as well as the province in the implementation and monitoring of those recommendations. I must indicate to you that we have quite advanced. Some of them have been implemented, others are still in the process of being implemented, but it is an issue that we are following very closely.
Well, thank you so much for your time. That was the CEO of the Office of the Health Standards Compliance. Michelle, if you'd allow me now just to bring in Thomas Holmes, who, of course, brought us here to this gathering, and essentially having this inspection and investigation done at Helen Joseph after he took several videos during his 2 weeks at the facility. Thomas, thank you so much for your time, sir. I think first and foremost, your reaction to what the Health Ombud had to say in regards to the claims that you've made and perhaps maybe their investigations and what they looked into.
I get nervous when I'm called Thomas and by my given name.
Tom London.
Just call me Tom. Look, as far as the allegations that were unsubstantiated are concerned, and remember that when I say I wasn't happy with the way the doctors were treating me, I don't believe I speak alone. I think I carry the voices of tens of thousands, perhaps millions of South Africans who joined me when I said that, by the way, and said we're not happy either. So, and I understand the Ombud has to be unbiased, and has to do investigation, speak to everybody. But, I'm prepared to let that one go. I think the President has said enough in Parliament when he stood up in SONA and said that he included healthcare workers' attitudes in what needs to be improved. And if I'm not mistaken, Premier Panyaza Lesufi mentioned poor service in hospitals last week in the G20 meetings in Johannesburg. So whilst I would love to see the Ombudsman say he agrees with me or they agree with me on allegation number one, that the doctors could have treated me better, I think the public know that healthcare workers need to treat us better, and I think our President and our Premier know that. So I'm in agreement with the President and the Premier on that one. However, I would say that the report is excellent, and I'm very, very happy to see this report. I think this is one of the first times in our country's history where we've taken a situation that is dire and we've opened it up for proper inspection. I know the media want to use the word damning report, but I'd like to use the words honest and open. The Ombuds Department as well as OHSC have been open and honest about what's going on inside Helen Joseph. The Minister and the Ministry has been open and honest about what's going on inside Helen Joseph. And I think that's very refreshing. As a South African, I'm very, very happy to see that we've discussed the problem amongst each other, and we will find solutions and we'll fix it. There's this sign there that says, let's grow South Africa together. Fixing healthcare can't be a war. There can't be winners and losers. We're all in it. So let's fix it together.
Well, thank you so much for your reaction, Tom. That, of course, was Tom London, also known as Thomas Holmes, just giving his feedback there, Michelle, in regards to the report. I see the health ministers here just very quickly, if you just allow me as well, Michelle, just to get a quick one from him. Ntate Motsoaledi, thanks for your time. Just looking at the reaction from the report, we heard Mr. Thomas Holmes there saying that this was an opportunity to do an honest inspection of the healthcare facilities. But the recommendations that came out from here are some that we've heard before in terms of the healthcare system entirely. What needs to happen to change so that we can no longer see these kind of viral videos that we're seeing and the complaints from South Africans?
Well, indeed, he is right that it was high time that we look into these matters. And you remember when I was speaking there, I outlined quite a number of things, like delegations of functions. I mean, it's very painful to hear the report from the Ombud that the hospital, the paint was peeling. And if you go there, they are going to tell you that, no, this function is not with the hospital. It's either in some department of infrastructure development or somewhere. It can't be. There ought to be delegations. And we have got the National Health Council this month. We are going to, because we did ask for these delegations. And it's just that they didn't happen. One will have to put up a very strong team that goes to insist and see delegations in writing that so-and-so is delegated to do this and that. That's why, if you listen to the President's State of the Nation address, he spoke extensively about infrastructure in health. because we know that's where our weakness is. And this morning I met the Development Bank of South Africa because they've got many engineers and very knowledgeable people to look into this issue, because I no longer want people in other departments who do not have skill to be in charge of the infrastructure. It's not working, we can see that.
And very quickly, Minister, just implementation of the recommendations. Do we know yet a deadline very quickly and how this will be monitored?
You'll appreciate that the recommendations were given to is for the Gauteng Department of Health and the hospital. But as the minister, I will have to do oversight on that to make sure that they happen. So what I'm going to do, because we've got the National Health Council this month of March, even though the Ombud did not give the deadlines, I'm going to insist that we do deadlines, because we must also discuss this for other hospitals, not just for Helen Joseph, because we know it's true that many other hospitals have got a similar problem. So I'm going to put a framework and say, this is what the Ombud said to Gauteng. It applies to all the other provinces. This is what the Ombud said to Helen Joseph. It applies to all the other hospitals, and this is what we want to see.
And we'll be looking forward to that deadline, Minister. Thank you for your time. Michelle, of course, the reality is for Helen Joseph is that it faces a similar crisis to many hospitals, not just in Gauteng, but in the country. We heard the minister there saying that they will be implementing these similar recommendations across the health facilities in the country. And of course, this an opportunity perhaps also for South Africans and consumers of medical health to look at the fact that if there are complaints, that there is, regulatory bodies that they can reach out to make sure that those complaints are heard. And of course, we'll also be keeping a close eye on what happens in terms of changes in terms of Helen Joseph as well as its management crisis.
Veronica Makhoali, thanks very much indeed. A real breakdown of all of the issues that we've heard during the release of these findings.